once again for joining me on the program, Your Doctor in COVID. I'm Dr. Mahendra Carpen. I'm the head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. As usual, I'd like to tell you and demonstrate the best way to wear your mask. You can see it, or I'm telling you that it's completely covering my nose and mouth, and to wear it any other way would not give you the kind of protection that you absolutely need. Today we continue our conversations surrounding the COVID-19 pandemic. And remember, if you yourself have questions or comments, you may send us a message to 620-6275 on WhatsApp, or send an email to docandcovid@gmail.com. Today we are going to do something a little bit different. I'm going to be speaking to someone who would have survived the COVID-19 pandemic in terms of being a patient himself and spending time in healthcare institutions in Guyana, and at one point becoming sick enough to be admitted to the COVID ICU. So I'd like to introduce you to Mr. Niaz Suban, who is no stranger to us who are following the media. He's a member of the NCN family, and he would be someone that we can learn a lot about from the perspective of a patient who would have had COVID-19. So Mr. Suban, thank you very much for joining us today, and look forward to your contributions and your discussions about what you can actually tell us about your own personal experience.
Thank you for having me, Doc.
Very well. So let us start off by introducing yourself a little bit. Just tell us a little bit about who you are, where you're from, and what do you do?
Well, I think you'd have captured it basically there. Basically, I am a media theater personality. I've done a lot of theater in my life. I've worked in the media for many years. I'm currently also commissioner on the Ethnic Relations Commission, and I also do a lot of work for the promotion of Indian culture.
Very well. So thank you very much for your service. So let's get right into it for you to tell us a little bit about your own personal experience as it relates to the COVID-19 pandemic and COVID-19 infection. How did you actually find out that you were COVID positive?
I want to say by strange coincidence. I was not feeling well for about maybe 7 or 8 days, and I felt I needed to get some medical attention for an underlying condition that I had. And at that time, whatever symptoms I might have been experiencing would have subsided at that point. But it was very severe before I decided that I needed to get medical attention for the underlying condition, because I was very scared of what I was feeling. And when I got there, and they did what they had to do, and I was discharged, and as I was about to leave, I coughed slightly, and within seconds of me coughing slightly, there was a change in the room. The staff resorted to what I learned to be COVID preventative measures. They put on various kind of clothing and all of that, and I was told that they will summon the unit or members from the COVID unit to come into the ward, and they came in with their protective clothing and spoke with me and told me that they think I needed to be tested and I should be tested the next day. Turned up the next day, tested, and then 48 hours after I was told I was positive.
Wow. So you had no idea, no suspicion whatsoever that this might be COVID. So a cough prompted the healthcare workers to take that action.
In retrospect, as I had symptoms, but I never thought that they would have been COVID related. Remember, that was in the very early stages. I can tell you the exact date. It was actually the 16th of March.
16th of March?
March, when I started feeling some strange symptoms. Well, not strange to me, because I suffer with tonsillitis most of my life. And whenever I get that, I would get some fever and coughing and so on. So I thought it would have been that, but the fever was very, I don't know how to describe that. I'm not a doctor, but it came in cycles, and it was very, my body would shiver, extremely cold, and then it's about half an hour after, or so I feel very hot. I'm sweating a lot, and I still felt it was related to tonsillitis. I even went and got tested for dengue, because I had dengue 2 years ago. That came back negative. So between that period before I went to the institution to check my underlying condition, I was really sick. I was terribly sick. I was in bed all day, coughing, sweating, feeling cold, couldn't eat. So in retrospect, I felt I would have exhibited the symptoms, but the symptoms, they went away enough for me to be able to get to a hospital and check my underlying conditions. I mean, when I was told that I was positive, I was shocked because I didn't know anything about the disease. I thought if the symptoms went away, well, that was the end of the story. So when I was tested positive, I was really, really shocked because I felt to myself, I'm better, I'm walking, I'm eating, I'm not having any fever, no persistent cough. So I was kind of shocked until I learned about it afterwards.
So this was about the middle of March.
Yeah, exactly in the middle of March.
And we had our first COVID death earlier that month.
About a week before that.
Yeah. And were you aware of any exposure at all to that COVID family on the East Coast, or that any exposure to what we call our index patient?
No, Doc. I knew I was not to that family, and it's still a mystery to me how I contracted the virus. I tried to trace a lot of stuff, and it was difficult because I think even though in my studies of science I know the word asymptomatic, I don't think at that time the word was used very commonly, so I don't think I can really trace it to a particular point, but I'm happy that people that I was in proximity with, they did not contract it, and that made it even more mysterious to me as to where could I have gotten it. But in the end, I was diagnosed and can't change that.
Would you assume then that there were more than one person around in the community that was exposing others or caused the spread of this virus at the time, other than the index patient that presented to the hospital and unfortunately died then?
I would want to think so. Because it basically was from work. At that time we were in elections period. I was an observer for the elections. And as I'm saying that a lot of people were people who I would have interacted with, thankfully, no one that, according to what I know, would have contracted the virus. And as I said, I could only remember one other incident. I was accosted by a group of people on the 13th of March. That was a very significant day in our history at that time. I was accosted by some protesters, and they were in my face and all of that. When I say literally in my face, I was about to be assaulted, but they didn't hit me, and I want to make that very clear. People in that own grouping ensured that I wasn't hurt. They yelled, "Don't hit the guy." But I'm not sure if there was any exposure there because with everybody speaking, shouting, and saliva droplets coming to you. At that time, I wasn't thinking that. But in reflecting, I don't know if that was also potential.
The chances are, if that was around the 13th and you tested positive on the 16th.
No, I tested positive. The test was done on the 30th.
Oh,
but on the 16th is when the symptoms began.
I see.
The symptoms began, and then it took a few days before I got to the hospital.
So then, from a purely scientific analysis, if the symptoms started on the 16th, you would have been exposed about a week before that.
Probably.
And so by the time your symptoms started, the 2 days before that, you were potentially a source of infection for others who would have been around you. So those same protesters perhaps unwittingly might have been exposed to you in a way that put themselves at harm. So the symptoms that you described are very classic and textbook. You mentioned shaking, that's called chills.
Okay.
And then there was fever, and fever is the commonest one. Were there any other symptoms that you experienced apart from fever and chills?
Oh yes, I had this terrible cough. Cough is nothing new to me. But why I thought it wasn't COVID, because at that time, from what I was reading, they were saying you have to have a dry cough. But I was having a productive cough, and I was tremendously weak. I was very weakened. And Doc, I can tell you this, I've had illnesses throughout my life at various points. Never in my life did I experience so much pain in my knees and ankles. That pain was so unbearable. I think if I had to rate the headaches that I had and the other body aches that I had, I think the joint pains trumped
So
everything.
headaches and joint pains as well.
And weak. I
and
felt very
coughing.
weak. Yeah.
Yeah.
But
How about muscle aches?
yes, I had all of that. You
Yeah.
know, weak, and when I got some cramps in my shoulders trying to sleep. But the pain in the knees and the ankles was so unbearable that I couldn't even have the fan on so that the breeze, can blow over it because it pained.
Yeah. So I'm very glad that you would have recovered from all of that.
Thanks.
How did you feel emotionally, mentally, all of that when you were told that you were COVID positive?
First of all, I was in disbelief, and I kind of doubted, and I literally begged. By then I was isolated from my family, and I begged if I could have stayed at home because I was all alone, and I even asked, you can come and check my home, do whatever you want to do, can I stay at home? I was in so much disbelief. But I was also traumatized for two reasons. One, my request was not granted, and I understand why, and I have no regrets about that. I was traumatized first that I wasn't certain what I was going to meet when I was going to be in isolation. And two, because at that time there was the COVID protocols that came out initially, in my humble opinion, I felt they were draconian, or some of them are very draconian. And there was this belief that your house could have been destroyed if you were COVID positive. I was worried for my family. I have young children. The youngest being 5.5, but he'll be 6 now. So I was really worried if they had to be in isolation because of whatever. So for me, that tormented me mentally. Would my home be destroyed? I asked the question the night with the official, and they assured me no, that they would fumigate at some point. And with the family, I couldn't get a response on that. They had to do their contact tracing and whatever the case was. So those two things, when I was getting into isolation, it tormented me every moment that I was in there, at least for the first 2 weeks.
Okay. So going back to when you were told that you're positive, or rather when you first coughed in the healthcare facility, did you get an impression that they had suspected that this might be COVID? Were they, before the cough, was anyone giving you the impression that they were prepared for this?
Well, yes, I had to wear a mask. They had on masks. They sanitized the place, the bed, and so on. I was the only patient in at that moment, and at that time, Doc, remember, not much was available to ordinary people who are not in the medical field about COVID. So imagine me when I coughed, and immediately you felt that there was like a pause in the room, and swiftly you saw this transformation.
Right.
But ought to be outer protective clothing being. Well, I don't even think I heard the word PPP or the initials PPP at that before
PPE,
then.
personal protective equipment.
The personal protection equipment. But I saw the staff putting on these things, and I got really, really scared.
Yeah.
And then they told me, we cannot let you go. You have to wait and to be checked and whatever. I was terrified.
Yeah.
Very terrified.
How was the news actually broken to you? Did you feel that this was there was some compassion involved? Was it a harsh experience? How was it broken to you?
I think it was a doctor who called to convey the results to me, and he was very professional. He told me his name and whatever, and when I asked him if I could stay, he listened. He didn't tell me no right away. He didn't tell me no right away. He listened to me, and then he said that that's not a decision he can make. He will have to seek guidance before he can say anything definitive to me. And he called like about 3 or 4 times, checking in to see that I was there and telling me that they'll be coming shortly and whatever. So I thought that he did a very professional job in conveying the message to me.
Good. Well, I'm glad. Remember, those were the early days.
Yeah.
And I suspect we were still working out a lot of the protocols, things that might seem normal and routine now. In the last 7 or 8 months, we would have had practice. And things that are normal and routine now, we were struggling and scrambling at that time to establish and make sure everyone knows what the protocols are, healthcare workers as well. So we will continue this conversation, but I just want our viewers and the listeners to know that if they have any questions or comments, they can feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com.